have you seen any everyday things that parents can do that have really helped manage their child's asthma?
Well, nutrition is an everyday thing, and I like my patients to kind of change their diet for the good. It's not only whenever they have asthma flare-ups or when they have allergies that they should be eating healthy, and the rest of the time like binge on bad food. So I usually tell my parents to kind of change the foods, change the way they are kind of shopping for food. You know, they buy stuff. Everything needs to be changed. Even like the cleaners they use. I have a link on my website which tells you what cleaners you can actually use for home cleaning, which are like least toxic, which are organic, which wouldn't trigger any of these allergies. And the other thing would be the nutrition. If you change it completely, like starting from what the child eats for breakfast, lunch, dinner, their snacks, everything at all. And then, of course, basic things like as soon as the child comes inside, make sure they wash their face, wash their hands, rinse out all the pollen and all the allergies, all the allergens from their face. That decreases allergies too. So these three main things, like, you know, whatever chemicals you use in the house, make sure they're not anything that triggers them. The food that we put inside our child, make sure that's not triggering it. And then outside, to keep the house as clean as possible, no dust. You know, we can use HEPA filters, make sure there's like wood, reduce the carpet exposure as much as possible. So these are the basic lifestyle changes that has also known to work a lot.
And on the flip side, are there things that you see parents doing or not doing that can land their child in the ER?
Yes. I mean, if they follow these things, it would not end up with the child being in the ER. Unfortunately, what's happening is there's lots of parents who have kids exposed to people who smoke in their house. And every time they come in, we can actually smell the cigarette smoke in our office. It's like we have to actually clean and spray after a patient. So it's really strong. So you can imagine a child who lives with these parents day in and day out is breathing that smoke. Their respiratory passages are going to get irritated and they are going to get more prone to get allergies and asthma. But when you try to tell them that these allergens need to be removed, like they cannot be around people who smoke, at the most, I mean, what they do is they say we smoke outside. We don't smoke inside. But that really doesn't help because that smoke and smell stays with the parent, which can still cause problems with the child. So I've seen a lot of kids who are not improving only because of this. Is because I know that their parents are still smoking and they're still exposed to all these allergens. And unless that's taken away, it doesn't matter how many supplements we add, what medications we do, it's not going to get better.